Hi guys, Metal Misty here. This is week 2 of my post-op blog, I suppose, for the shortening of my ulnar. Okay, so yesterday I went to the back to the hospital, an outpatients, and what they do, they take away the bandages, and then you look at the scar and go, wow, how big is that? And then they took the stitches out, and then they put you into a cast. And I got a really cool purple one here. I usually wear black, so they could have black one as well if you wanted to, but the kids want to draw all over it, so this is a nice hard cast, and it's a lot more comfortable now in a full cast than it was with the back slab and the bandages. Okay, so what I saw from the operation is that there is a scar coming from the side of my wrist, and it goes all the way down to about here, and so it's quite a large scar where they obviously cut me and shortened the ulnar. Apparently the shortening of it was about 3 to 4 millimeters in length, so it's quite a substantial change in the actual length of the ulnar. Excuse me, my throat's going, I've got a bit of a cold. To stabilise and make sure that the wrist is in correct alignment as it should be. So anyway, that was yesterday. I suppose medication-wise, I'm still on the paracetamols, ibuprofen, and the codeine. Not as much now because this pain is not as bad. I still obviously can't pick things up with this heavy stuff up. Turning things is difficult, so just use your fingers. Try and keep it up as much as you can, but obviously exercise your arm, because what I'm finding is there is a little bit of a pain or an ache in my elbow section. Whether it's because I'm not moving it or it's just because it's the bruising that's going down, I have no idea. So, if you guys got the same problem, you know what it is, let me know. Excuse me. But yeah, the pain's a lot better. I think it's because a lot of the pain that I was getting and feeling, the stretchy feeling and the tightening, was where the bandage and the covering of the wound was just touching and pulling slightly on the stitches. So obviously when that's gone and put the new one on, it's a lot better. The actual stitches themselves were brilliant. I mean, you can't, the old-fashioned way of putting the dots either side, didn't get any of that. They basically put a long line of thread, blue thread. So when they removed it, they just literally pulled the whole lot out into one line. So you've got a nice, clean, single scar that goes all the way down there. Of course, it's going to be pink and red as it's going to be healing, probably for a good 8 months, I guess, and then it goes white when it's all healed up. So I've got to keep this on for, I think, about 4 weeks now, and after 4 weeks I'm going to have it cut out. Then you go for an x-ray to make sure the plate, which is about that big, is stable still and it's holding the bones together and the bones are knitted together correctly. After that, depends on how the healing process is, you either go for another cast or you can get yourself, put yourself with a fracture or an actual splint, one of these metal ones. At that point, who knows, you can drive on it, but we'll see. So that's the update for the moment. Not having problems sleeping now, because I had a lot of problems sleeping beforehand with the lack of painkillers in my system. No problems with circulation, because you can see it's quite it's got quite a lot of movement in there, but stability for the ankle, the wrist is obviously there and is correct. So always check your fingers to make sure that they're nice and warm. There's no purpley bits on the end of them. Any problems you have, obviously go straight to your GP if you have got any worries about it when you have yours done. But yeah, I'm actually quite happy with this at the moment, and we'll see how we go on. Okay, so yeah, best of luck guys, and I'll see you probably when this is off in about 4 weeks. Okay, take care, bye.